Johnson County Department of Health and Environment encourages immunocompromised residents to get an additional dose. On this episode, hear the latest on how you can promote COVID-19 immunity.
Whether you live in or just love Johnson County, Kansas, JoCo on the Go has everything Johnson County. Here's what's happening and what's coming up in the community you call home.
Thanks for joining us for JoCo on the Go. I'm your host, Teresa Freed, a Johnson County resident and employee of Johnson County government. A lot going on in the world of COVID-19 transmission and vaccines. Here to talk more about that is Dr. Sanmi Areola, Johnson County Department of Health and Environment Director. Thanks for being with us.
Thanks for having me, Teresa.
Well, first off, can you just talk a little bit about the transmission levels right now in the community and the impact that we're seeing on our healthcare systems?
The activity level of the virus measured by actual infections, positivity rate, incidence rate are too high. We are right at about 385 cases per 100,000 residents for the past 2 weeks. Positivity rate, it's over 9%. To put that in perspective, when I presented to the board of county commissioners early June, positivity rate was at 1.3%. So that's an eightfold increase right now. And that's also true for incidence rate, where we were as low as 47 per 100,000 residents for the preceding 14 days, now at 385. That's also an eightfold increase. As I've said several times, we have a responsibility to bring those numbers down. It is safer to keep our schools open in person. It is safer for our children to be in school if we reduce the opportunity for the virus to spread. It is easier on our health systems, on our hospitals, if infections are down. Right now, they are at capacity. They are having staff that have to be excluded, either because they are positive or they are in quarantine. And also because we've been dealing with this now for about 20 months, staff are stressed. And so those pressure, I think collectively as a community, is a responsibility that we have to take seriously. And I know that we do, and I know that we have. But that's what we are facing right now. It's another opportunity for the community to rise up. We need to wear masks. We need to get vaccines into the arms of more people. Right now, using CDC's data, just under 72% of our residents are fully vaccinated, those that are eligible. One thing we have to keep in mind is those that are younger than 12 are not even currently eligible, and that's a big part of our population. How do we protect them? Here's how we protect them. Those that surround them, where they live, where they play, where they go to school, they need to get vaccinated. If people at home around them are vaccinated, if people at school around them are vaccinated, if people where they play are vaccinated and wear masks, we protect them even though they are not currently eligible. And I think that's a responsibility that we all share.
So we're hearing quite a few reports now that patients may be waiting in ERs, and the hospitals are at capacity and they're short-staffed, as you mentioned. So we're seeing a lot of the people with COVID in the hospitals are the ones who are unvaccinated. Is that right?
That is correct. I had a meeting with local health systems a couple of days ago, and our own MedAct director, Dr. Jacobsen, was there also. And so typically when we meet, we ask them where they are, and really they were all reporting 90%, 88% of their infections are in unvaccinated persons, and another 5 to 10% are in immunocompromised, or people with conditions that maybe will not allow a robust immune response to the vaccine. And so that's again another testament to the efficacy and of the vaccine. If you are vaccinated, even with infection, it doesn't rise up to the level of being hospitalized or or dying. And so it does blunt the severity of the illness. And that's why it's important. But yes, our hospitals are stressed. The EMS trying to find space for people with other conditions, having to spend more time looking for where space is. And spoke to all of them. In some cases, they have beds, they just don't have staff to do that. Now we are having people that are transported to emergency room, having to wait 30 minutes, 1 hour, or several hours before they can find space for them. It's just not the ideal situation in our community. If people need emergency medical services, they should be able to get it. And the hospitals are not accepting transfers. They just don't have those capacity now. Again, it is a responsibility that collectively as a county, we have to take seriously. We have to wear masks. We have to avoid crowded environments. We have to get vaccinated. Those are the paths out of where we are. And where we are is now sustainable. It's now somewhere we want to be for a long time. My job is to create conditions that support health. My job is to ensure that in the county, everyone, no matter who they are, where they are, have the opportunity to be as healthy as they can be. And that's part of our message. Of my message to you is right now, because of the pandemic, we're putting a strain on our health systems, and there's something that we can do about it. And I'm asking everyone to join us in doing that.
All right. And speaking of immunocompromised residents, the CDC recently came out with some new guidance pertaining to them and encouraging them to get an additional dose. So can you talk about that and who falls in that category?
Right. So the new guidelines from the CDC regarding the third or the additional dose for certain people moderately to severely immunocompromised persons is again because of certain things, maybe medication, organ transplant, HIV positive, all of those other factors that could impact the ability of your system to mount a robust immune response to the vaccine. So there's enough evidence showing that an additional dose is very helpful to those group of people. And so the way that I have said it and to people, and the way that FDA really explains that you've got to do that in consultation with your attending physician. If you fall into that category, please go and do that. We have seen cases where even after the second dose, just checking the antibody levels, it's insufficient to protect you against COVID infection. So if you fall into that category, I am encouraging you consult with your physician, get that third dose, and before FDA and CDC approve that, they look at all of the available data. And right now, we want you to be protected fully. And that additional dose takes you closer to being protected.
So the third dose for those who are immunocompromised shouldn't be confused with a booster shot for the general population. So can you kind of talk about how those terms are used, and then also what's the projection for boosters for that larger group?
Right. So boosters are different. We don't currently have an approval or a directive from CDC for providing boosters to the general population. The additional dose that's currently approved is, again, for moderately or severely immunocompromised. Boosters are different. So every one of us that have taken the first 2 shots of the mRNA vaccines, that's the Pfizer, BioNTech, and Moderna, will be eligible for a booster shot when it is approved. Now, the reason I said when is we have had in the news 8 months after the second shot. Yesterday, we had possibly 6 months. but those are in the news. We take our instructions from the CDC and the KDHE. We don't have those yet. When we do, we'll let you know. But the way that that's going to shape up is we have seen scientifically evidence that a third dose significantly boosts the immune response. And in theory, that just means a more robust defense against severe symptoms, hospitalizations, and death that results from COVID. Now, when that becomes available, when we have the directive from CDC, we will let you know. Of course, we have vaccinated hundreds of thousands of persons in our county. So logistically, we're starting to work on those things. We are consulting with our health systems. One of the good things right now is we have a lot more providers in the county than we did in January when we were vaccinating. But also the challenges that the health systems are facing in terms of staff shortages is going to play a role. But we are reaching out to everyone. We are looking at ensuring that we vaccinate our most vulnerable population in the long-term care facilities. When we went through the first vaccination campaign, they were vaccinated through the Federal Pharmacy Partnership Program. And so we are looking at whether that will still be in play. And I think recent evidence suggests that the federal government might support that too, and that would be pretty good. I've checked with all of our health systems; they're going to participate, maybe in slightly different ways than they did the last time, but they will be offering the vaccine when the directives come. And so, as we said earlier in the year, still the fastest route is through your relationship with your primary care physician, your doctor's office. They have the vaccine. But again, we don't have the directives now. When we do, we'll be providing more information to the general public.
And we're already getting questions from the public who used our vaccine clinics early on. I want to get on your list to get a booster. And so just to be clear, there is no list at this time, and the process might look different.
There is no list at this time. I don't have a directive, official directive from the CDC or KDHE. Everything that we're seeing is largely in the news. And yes, we have been on a few official calls with the federal agencies to know what's going on. And so, but again, there is no list, and the process will be different. But when we have the directive and we firm up the logistics, we will keep you informed. We'll reach out to you. Here's what you should know. We want you to get the shot. We will give you all the opportunities to get the shot.
Perfect. Okay. Well, also from the federal government, we recently heard that the FDA gave full approval for the Pfizer vaccine. So can you talk a little bit about that? And then I'm sure people who maybe got the Johnson & Johnson or got the Moderna are wondering, does that mean my vaccine is any less effective?
Thank you. That's a great question. A few days ago, the FDA gave a full approval to the Pfizer BioNTech vaccine for those that are 16 plus. You would remember that the approval for 12 to 15-year-old came later. To be clear, it's still the same vaccine that we were giving a few months ago. It's the same formulation, the same dosage. It's not any different. It's just the process. So again, because of the benefits and because of where we were, it was pretty clear that an emergency use authorization is needed because the process for the full approval takes time, and we couldn't afford to wait. Again, after having tested those vaccines through very rigorous, the United States has the most rigorous process for approving chemicals, pharmaceuticals coming into the market. They were tested in tens of thousands of people through multiple stages. They were tested for efficacy. They were tested for safety. And again, to add to those tests before the emergency use authorization is the fact that we have now given those vaccines to hundreds of millions of people. And we continue to see, even with the large data, that they are very efficacious and they're very safe. And that is the thing for all three of the vaccines. Right. So I expect in the coming weeks or months that we'll see similar full approval for the Moderna, for the Johnson & Johnson, and for Pfizer, 12 to 15-year-old, those are going to come. But they don't change what we know about the vaccine. They don't change the dosage. They don't change the formulation. It doesn't change the fact that they continue to protect against death and hospitalizations and severe illnesses, even with the more infectious Delta variant. That stands consistent that those that are vaccinated have no symptoms, mild symptoms, they don't die. And that's the key thing that we are seeing, even with the uptick in number of infections arising from Delta.
All right. And as we wrap up our conversation, we wanted to turn it back to schools. So the school year just started up, and we are seeing a lot of the Johnson County school districts utilizing the safety protocols of masking and social distancing or physical distancing, and then hand washing and all of that. So are we seeing an impact? Are we seeing increased levels of transmission among the school children at this point?
Oh, we are seeing an impact. Kudos to Board of County Commissioners in their capacity as the Board of Health for passing the mandate for K through 6. An even bigger appreciation for our school districts. 5 out of 6 extended that K through 12 requiring mask. And we have seen this school year across the country, schools in Georgia, schools in Missouri, schools in Mississippi, who opened, Arkansas, who opened without mask and have to shut down or go virtual or require or mandate mask within days of opening. In our cases, we are picking up the infections early because of wearing masks and because we are increasing vaccination in 12 to 15-year-olds, as well as we've had a huge portion of the staff and teachers vaccinated. We are testing early when we pick up symptoms and identifying cases, putting them in isolation and quarantining close contacts. Again, those that are vaccinated are not considered close contacts. If both parties are wearing masks, we don't consider them close contact. But you can see we are succeeding in keeping our children in school in person because of those efforts. And I mean, there's going to be some outbreaks, no question about it. But really, really appreciative and happy about where things are. It continues to be something that we have to monitor. We've dedicated a lot of resources to that. Our entire case investigation and contact tracing is prioritizing students because we want to keep our schools open. We have an epidemiologist, a case investigator, a contact tracer assigned to each of the school districts, and just working with them to ensure that we keep our schools open. Now, our success and the ability to do that depends on the cooperation that we receive from the schools. It depends on the schools working with us when there's a case and working with us to do the proper exclusions. As long as those continue, I am pretty optimistic that we'll continue to do what is the primary goal. Let our students be in school in person to take advantage of the social, emotional, mental benefits of interacting with others and learning in person.
All right, great information. And again, thank you, as always, for being with us and sharing this important information with our listeners.
Thank you for having me. Thank you very much.
All right, and to get more information about COVID-19 in Johnson County, visit jocogov.org/coronavirus. Thanks for listening.
You just heard JoCo on the go. Join us next time for more Everything Johnson County. Have a topic you want to discuss? We want to hear from you. Follow us on Facebook and Twitter at JoCoGov. For more on this podcast, visit jocogov.org/podcast. Thanks for listening.